origin of Lassa fever virus could be traced to Nigeria, as the first case of the virus was reported in 1969 in a town known as Lassa in Borno State. Since then, the virus had claimed no fewer than 5,000 lives, mostly in West Africa. The latest outbreak resurfaced in Kano on 21st of January 2020, as the people of the Pyramid City woke up to the news of the death of two medical doctors who were alleged to have died of suspected Lassa fever after operating on a pregnant woman who also died of the disease 3 weeks earlier. About 24 hours later, the Kano State Commissioner for Health, Dr. Aminu Ibrahim Anyawa, in a press briefing to journalists, confirms the outbreak.
On 20th of January, Kano State Ministry of Health was notified of 3 suspected Lassa fever cases, 2 medical doctors and a nurse. On the 21st January, the State Ministry was notified by the Gandua Reference Laboratory in Abuja that 2 of the aforementioned suspected cases had been confirmed positive for Lassa fever disease. The index case was a 28-year-old pregnant woman from Gwalaloha government area.
The World Health Organization report states that humans could contract the virus through exposure to food or household items contaminated with urine or feces of infected rats. Apart from its primary source from rats, human-to-human transmission through contact with body fluids like blood, saliva, urine and sweat also poses a serious threat, especially during the dry season. While residents look up to the state government to effectively handle the situation as promised, they speak with Cool FM on the measures they have adopted to protect themselves from the virus.
We are to try to protect ourselves by making use of hand sanitizers, making sure our plates are not left at the open, and to check our kids, make sure they wash their hands.
Wherever I know there is anything like rats, I'll kill it.
If I notify that person he is been contacted with that particular disease, I can never have a shake hand with him. Those people that has been contacted with that they are already in captivity in a hospital.
I feel like people should stay indoors for some time.
If you see a rat, what you should do?
Run away, of course. I'll run away. Am I going to kill him?
So we try to keep our environment clean, away from rats and things that are going to get us infected.
Commenting, a doctor of family medicine in Aminu Kano Teaching Hospital, Dr. Muhammad Adamu Askira, explains that there are no vaccines to shield humans from Lassa fever. He sheds more light on the symptoms of the virus.
Once there is a contact, it takes from 2 days to like 21 days to bring out the symptoms. The patient will come down with severe headache, fever, general body ache, diarrhea, vomiting, and in advanced stage, patients would now start having bleeding from the nose, the ears, and it can even lead to confusion and convulsion and even loss of consciousness.
Dr. Askira, who was a former president of the National Association of Resident Doctors, further outlines preventive measures.
What people should be aware of are this culture of personal hygiene, constant and regular hand washing, and we should avoid unnecessary contact. This handshake is good in our culture and religion, but with an outbreak like this, we have to stop doing this handshake. Environmental sanitation, we here in Kano, we are very, very known for being very dirty. People defecate anywhere. So those have to be stopped now. Constant use of bleach for our domestic purposes. This is a disease that has cure. So the community should now be aware that any kind of sickness anybody has, they should take him to the nearby facility.
Nevertheless, the medical expert warns that neither the state government nor the people can stand alone to combat the spread of Lassa fever, especially from human to human. Hence, the need to activate intensive campaigns on preventive measures which will help to break the chain of transmission of the disease in the state and the country at large.